Hello, my name's Mark, and it's my honor and privilege to take you through our rehab philosophy here at Mercy. Now, I'm a physical therapist by trade. So when I use the word therapist, I'm talking about the clinician that's working with you. I have a tendency to call everything a therapist. But that may be your physical therapist, that could be your physical therapist assistant, that could be your athletic trainer, that could be your exercise physiologist, that could be your technician. The clinician working with you is what I mean when I say therapist. You have an entire family of very highly qualified individuals that are going to be working together as a team to give you the best that you need. I just happen to call them all therapists. You're going to get two things from your physical therapist. You're going to get hands-on and you're going to get knowledge. Now, the hands-on is designed to do things that you don't know how to do with your body, and or you need an extra set of hands to do them. You can't reach it, you can't perform that. And that's predominantly going to be focused on the soft tissues and helping them heal. Now, some of those techniques you'll be able to learn and or will be able to teach someone to do with you at home. The other thing you're going to get is knowledge. I'm always telling my patients, if I could download what I know and plug it into your brain, half the job would be done. Learning when to do what, how to progress it, when to progress it, when to avoid things, what kind of pain is an okay pain, what kind of pain is a bad pain. Those types of things your therapist is going to teach you along the way. The more we can turn you into your own physical therapist, the better off you're going to be. So take the knowledge and take the hands-on from your therapist seriously and implement them into your own life, and you'll have a better recovery. The first thing we need to discuss is that rehabilitation is different than life. In other words, the things I do throughout the day in life shouldn't make up for what I do in rehabilitation. What you're going to get in rehabilitation is some very specific exercises that are designed to help your body heal as quickly and as efficiently as possible to get you back to what you want to do in life. But life and activities in life shouldn't take the place of your rehabilitation exercises. Don't let life get in the way of your rehabilitation. But at the same time, we do understand how important things are to you and how you need to get things done. But your exercises are exceptionally important for you to heal properly. Stages of healing. Your body's going to go through specific stages in the healing process. The first of which is a clotting phase, then an inflammatory phase, a proliferation phase, and a maturation phase. Now, during the inflammatory phase, you've got a lot of fluid coming to that area, and that's going to cause some swelling. It's also going to cause some pain. That swelling itself will decrease your ability to function, bend, move, and produce strength. So, that is the most important thing, and we're going to talk about that here in a little while. But during these phases of healing, you have to respect what phase you're in. You want to move forward, you don't want to move backwards. And your physical therapist is going to guide you in the tools you need to know so you can do just that. Swelling and inflammation. Swelling and inflammation are the key things you need to get a hold of for your rehabilitation to go smoothly. As your body part gets swollen after an injury, it limits your ability to move properly and it limits your ability to produce strength. You can't do motion and you can't do strength until you get good management of your swelling and inflammation. Now, rest, ice, compression, elevation, and manual massage is how you manage inflammation. The rest and ice will help limit inflammation from coming into the area if you've just injured something or re-injured something. But the elevation, the compression, and the manual massage will help get rid of the fluid that's already there. Your physical therapist is going to teach you these techniques and what you can do to manage your swelling so you can get the motion back and produce the strength you need to so you can function throughout your day. Scar tissue and scar tissue management. Anytime you injure the body and or have surgery, you're going to have scar tissue. And scar tissue is a good thing. It's the super glue that binds everything back together once it's been damaged. However, scar tissue not only binds edge to edge like the skin when you see your scar, but that skin, the layer of fat, layer of fascia, muscles, tendons, ligaments, joint capsules, it heals from top to bottom as well. So you get somewhat of a wall of scar tissue. Now, scar tissue can either be healthy scar tissue or it can be unhealthy scar tissue. Your physical therapist is going to be doing specific things and teaching you specific things to do on your own to help develop that scar as it grows and matures into a healthy, strong, pain-free scar. Don't neglect the scar tissue mobilization. See, pain nerves travel through healthy tissue and they travel through scar tissue. And as a scar heals, it has a tendency to get stiffer and tighter and stiffer and tighter and stiffer and tighter, and it's kind of shrinking. And you're constantly trying to stretch that scar out and make it mobile so you can move. It's kind of like paddling a canoe upstream against a slow-moving current. If you paddle that canoe as hard as you can for half an hour and just exhaust yourself, you're going to cover some ground. But that slow-moving current, once you're exhausted and can't paddle anymore, is going to take you back downstream. You're going to end up backwards. Managing scar tissue takes consistency. That's being in the canoe and paddling at a slow and steady pace. You're not making a ton of ground with every stroke, but you're making a little bit of ground, and you can keep up that pace throughout the day. And at the end of the day, you're going to be further upstream than you are downstream. Managing scar tissue is a lot like that. It takes consistency throughout your day to mold the scar into a healthy scar so you're not left with a tight, stiff, painful scar at the end of your rehabilitation. Pain and managing your pain. Now, none of us like to deal with pain, including myself. Your physician is going to prescribe you some medication to help get your pain under control. The key is that you can do what you need to do at a tolerable pain level. Now, there's no escaping pain altogether after surgery. However, keeping the pain at a level that you can manage it so you can do what you need to do, that's the key. See, a lot of times what will happen is a patient doesn't feel too bad without taking their pain medication if they're just sitting around and resting. The body is designed to move. And if we're not doing the specific exercises that you need to do, because it hurts when you start to do those, it doesn't feel too bad when you're resting, but as you start to do your exercises, it starts to hurt. So now I'm not taking my pain medication, and I'm not doing my exercises as often as I should, and my rehabilitation suffers. The key is keeping your pain under control so that you can do what you need to do in your rehabilitation exercises so you can achieve the goals you want to achieve and get to where you need to be after your surgery. How the body's designed. One of the analogies I like to give is the body is like a stack of pennies. If you can get all those pennies lined up directly one on top of the other, they balance real well. The different pennies represent different parts of your body. However, throughout life, you're going to have sprains, strains, bumps, bruises, and that kind of shifts a penny off to the side. You have one up here, you have one down there, and the more things shift, the harder it is for the system to balance. Now you suffer an injury, or you require a surgery. That shifts a penny way off to the side. Your body is struggling to stay in balance. Yes, one of our major goals is to get that main penny back in alignment. But the thing is if we can get all the pennies in a little better alignment, your system is going to function a lot better. So we're not only going to focus on the one penny to get it back in alignment, but we're going to be shifting pennies everywhere so it can help that penny. See, every penny relies on the penny above and the penny below. The entire system relies on the one that's way out of whack, and the one that's way out of whack relies on the rest of the system. This is why you're going to be doing some exercises that may or may not seem directly related to your injury. We're going to be working on your entire body. Another way to look at it is baseball. If I have a baseball team and my pitcher gets injured and I have to pull him out to rehabilitate him, I don't send the rest of the baseball team off on a break or a vacation. The rest of the team still needs to work, still needs to practice. Because the reality is I have good baseball players, I have fair baseball players, I have poor baseball players, and I have injured baseball players. While you're working on the injured baseball player, your goal as a coach would be to take those poor baseball players, turn them into good baseball players. Those good baseball players, turn them into excellent baseball players. And then as your pitcher gets to a point to where he can reintegrate back into the system, your team is already stronger than it was to begin with. That's what we're going to be doing with your body. We're going to be working on your body in all the areas of dysfunction. Yes, we're going to be focusing on your primary injury, but we're going to be working the entire body as it's designed to move. See, from head to toe, your body is designed to move in a certain way. You've got areas in your body that are designed for mobility, and you've got areas in your body that are designed for stability. Now when I say stability, I don't mean stiffness. I mean stability in that it can transport forces from down to up, from side to side, and from up to down. It transmits those forces from one area of the body to the other, and it's stable while it does it. A good example is the foot. When you walk, your foot needs to be stable. If it wasn't stable, the foot would just fold up like a shoe and you'd fall on your nose. The foot is stable. The ankle, however, is designed to be mobile. The ankle goes forwards and backwards, side to side, and rotates. It's a three-dimensional joint. The knee, it's a stable joint. It's designed to move, yes, but it moves forward and backwards, kind of like my finger. It doesn't go side to side very well, and it doesn't rotate very well. The hips, however, are three-dimensional, like the ankle. Side to side, forward and back, they move all three planes of motion. Your lumbar spine, designed for stability. It flexes and extends. Very little rotation and side bending in your lumbar spine. But the thoracic spine rotates, side bends, flexes and extends. The thoracic spine is designed for mobility. The shoulder blade, stability. The shoulder joint, obviously mobility. The elbow, like the fingers in the knee and the lumbar spine, stability. The wrist, mobility. Forward, backwards, side to side, rotates. The hand is designed for stability, so we can grip things and manipulate our environment. So if you look from the floor up, you have a stability in the foot, mobility in the ankle, stability in the knees, mobility in the hips, stability in the lumbar spine, mobility in the thoracic spine, stability in the shoulder blades, mobility in the shoulder joints, stability in the elbows, mobility in the wrist, stability in the grip. You also have mobility in the cervical spine. So as you're doing your exercises, it's more than just contracting one muscle and moving one joint. Yes, that's the penny we want to focus on. But the thing is we need to work mobility where your body's designed to be mobile. If you're stiff there, you're not going to move right, and you're going to have problems. If you're not stable where you need to be stable, you're going to have problems. Throughout life, what happens is where we're supposed to be mobile, we get a little tight. And where we're supposed to be strong and stable, those areas above and below that mobile area, they try to make up for it because the body's designed to move. And if I'm not moving where I'm supposed to move, I'm going to try to move where I'm supposed to be stable. And that leads to degeneration and injury. So during your rehabilitation, we're going to tune your whole system. Ideally, when we're done rehabbing your injured body part from surgery, your body as a whole is going to function better than it did before the surgery. And along the way, we may be preventing other injuries from occurring down the road. This is a whole body approach, and this is part of Mercy's philosophy that's key to your rehabilitation. So when you're asked to do these exercises that may or may not seem directly related to your injury, these abdominal stabilization exercises, these diaphragmatic breathing exercises, these shoulder stabilization, grip, it's because we need to move your body like it's designed to move so it heals as best as possible. There's a difference between a rusty old pickup truck and a Ferrari. The Ferrari is sleek and it moves well. That's what we're going to be working on, is we're going to try to turn you into a Ferrari from head to toe. Grip. So why is grip so important? Actually, according to the literature, grip is one of the primary elements you can measure to help determine how healthy an individual is. They've done studies where when a person's grip is way below where it should be, that's a direct reflection of their nutrition and their physical status overall. Now, I'm not going to change your nutritional status and your physical status by improving your grip. But the reason I'm working grip is because the body is designed to be stable in the fist, like we've talked about. The body is also designed for proximal stability, for distal mobility. If I need to manipulate in my environment, if I need to push, pull, lift, carry, walk, I need to be stable in my center so that I can move in my periphery. Now, I just said I need to be stable in my grip. Think about it. If I'm gripping something hard, I'm telling my brain that something's about to jerk me or I'm about to jerk something. And neurologically, when I grip something hard, and I create distal stability in my hands, I neurologically create proximal stability in my core, because my body is getting prepped and ready to either be jerked or to produce a jerking force. So during your exercises, we may be working on a body part that seems completely unrelated to your hands, but we're going to be asking you to grip firmly to create that neurological linking for proximal stability, for distal mobility, making you stable where you're supposed to be stable so you can move where you're supposed to move. Breathing. So how important is breathing? It's a rhetorical question. And I used to think as long as you were alive, you're breathing just fine. The reality is you can breathe a lot of different ways. You can breathe with your diaphragm, you can breathe with your lower ribs, or you can breathe with your upper ribs. Now, the diaphragm itself is part of your innermost core stabilization muscle group. And learning how to use that diaphragm and those core muscles for stability is going to be key to your rehabilitation no matter what body part you're working on, because that's how the body is designed to be. But you can also use breath to help bring energy into your system and pep you up and calm your system down. See, it doesn't matter where you are from in the world, where you grew up, whether you're boy, girl, old, young, everybody laughs the same, everybody cries the same, everybody yawns the same, everybody sighs the same. Say you have just so much energy in your system, you just got to let it out. You're like a teapot that's just boiling over and it just needs to blow out the steam. It's a short inhale, long exhale. Now that can happen whether you're excited, whether you're happy, whether you're sad, or whether you're mad. It's emotion driven, but the breath that your brain chooses to use is to help balance your system back out. If you're mad, it's a quick and a long long exhale. If you laugh, something's just funny. If you've ever laughed so hard that you can't breathe, it's because you can't inhale. It's a quick and the long ha 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 as you exhale. Those are breathing patterns that I've got too much in my system and I need to calm it down. We use this all the time in cardiac rehabilitation. When a patient's blood pressure and heart rate get too high, we tell them to pursed lip breathe, which is where they inhale and then blow out through pursed lips. That relatively shorter inhale and the longer exhale will drop their blood pressure, drop their heart rate, and calm their system down. Just like screaming, just like laughing, it's letting energy out. Now think of this. After a long day, since you're mentally exhausted, mentally it's just been a long, long day, and you walk outside and it's a beautiful spring day, what's the first thing everybody does? Long inhale, and they let it out. Say you've had an emotionally devastating day, and you're exhausted. What do? You do the long inhale, short exhale. It's the sigh. It's the yawn. You can use these breathing patterns to help calm your system down or pep your system up. Why do I say this? Most patients, when they come out of a major surgery, are a little anxious. They hurt. They got an owie. Their system is guarded and protected and tense. I need to calm that system down. And now we ask them to do exercises, which may cause a little bit more pain. Now they're even more tense and more stiff and more anxious. Use your breath. Okay? Shorter inhale, long exhale. Just like our cardiac rehabilitation patients, it'll drop your blood pressure, it'll drop your heart rate, and it'll neurologically calm your system down, bring you back into balance. Breath is a strategy for your body, and it's also core stability. Breath is extremely important, and your therapist is going to teach you how to breathe properly to help your rehabilitation process along. Choosing the path of least resistance. It's in our nature, no different than lightning and electricity. If I can change a channel on the TV by hitting a button versus getting up and actually moving to the TV, my body's going to choose the path of least resistance. If I have to bend over and pick something up, and I can use small muscles in my back that don't require a lot of energy versus large muscles in my butt and thighs that require a lot of energy, my body, if I'm not consciously thinking about it, will choose the path of least resistance. I'll use those small, energy efficient muscles, and I'm going to bend over poorly. That's one of the major principles of the human body, is you need to train your body how to move properly, consciously, and then eventually you do that enough, it'll become subconscious, because the body's natural desire is to choose the path of least resistance. Quantity versus quality. Your body innately will always sacrifice quality for quantity. What do I mean by that? Say I have a really bad sprained ankle and I still need to get out that door because there's a fire alarm going on. Now I'm not going to move well, but I'm still going to get out that door. My body is going to learn how to move around my injury or my pain or my dysfunction. The body will choose quantity of steps to get there over quality of steps of how I do it. Now as a patient, you need to learn the difference. Are you moving qualitative or quantitative? Can you walk for 50 minutes, 60 minutes, 70 minutes, but you walk with a limp and a stiff ankle and a stiff knee and a stiff hip, and your body's just getting from point A to point B? Or are you moving well? Now, you may be able to move well for a short period of time, for a 5-minute walk, for a 10-minute walk, and then your form starts to get sacrificed. That's when you're done with that exercise. Same thing with your static exercises, when you're on your back, laying on your side, sitting in a chair, standing exercises. When your form starts to suffer, you're done with that exercise. If you continue to drive through and make your body move in a poor manner, you're going to promote dysfunction, you're going to prolong your healing process, and you're not going to reach the state of function that you want to reach. Make sure your body isn't sacrificing quality for quantity during your rehab process and during your life as you move throughout the day. Nutrition. Now we all know nutrition is important for your body, but never is it more so during a rehabilitation process. If you put horrible fuel in a Ferrari, that Ferrari is not going to run like it should. During a rehabilitation, you're going to need to take some special time and make a special effort to watch your nutrition. You're going to be getting some information about this and help guide you along the process in how to better your diet so that your body will heal better. Earning the right to progress. You as the patient are responsible to earn your right to progress in your exercise program. You need to own the lower level exercises and perform them well before you can advance into upper level exercises. You need to own a movement pattern before we load that movement pattern. You never ever want to add weight and resistance to a movement pattern that's dysfunctional. If you move in a poor movement pattern, you're not stable where you need to be stable, you're not getting the motion from where you need to get the motion, and you add weight to that, you will neurologically solidify that poor movement pattern and eventually cause yourself more pain, more dysfunction, and prolong your healing process. You have to stabilize in the foundation exercises before you can move up to the higher level exercises. You need to move properly before you load that movement pattern. Now each one of your exercises groups that you have are going to go from a lower level to a higher level, and you need to perform those lower level ones perfect before you can advance to the higher level exercises. Goals. So we've talked about a lot today. I want to simplify it back down. You have specific things in your rehabilitation process that you've got to manage well for you to be successful. The first and foremost, you got to manage your inflammation and your swelling. You got to take command of your pain and manage that pain so that you can do what you need to do to make the progress you need to make. Then you need to get your motion back. As we talked about, the body is designed to move. And if it's not moving, it's not going to function right. Then we work on strength and stability, and then balance and coordination. And by the time we're done, we have an entire package. But that's the order that you have to concentrate on things. If you're not managing your pain, you're not managing your swelling, you're not getting your motion back, it makes no sense and no benefit to you to work on strength and balance. Work on them in that order. Your physical therapist is going to guide you through this process. And your exercises are going to overlap some. But never neglect the basics. You got to have a strong foundation to build a house. And that foundation is managing your swelling, managing your pain, and getting your motion back. Now, when we're done with this rehabilitation process, your body should be functioning better than it did before the injury, because we're going to be working on you from head to toe. You're going to get one of the best rehabilitation exercise regimes that exists out there today. It's based in research and an extensive amount of experience. Your surgeons are excellent surgeons, and your therapist is going to take care of you. If you do your part as a patient, you're going to have the best recovery that you can expect. God bless. It's been my pleasure working with you today and educating you on this. I wish you the best.